Hello, everybody. I'm Amber, and I'm the founder of Donate for Refugees. And I'm very pleased today to be here with Mohammed, who is joining us from Lesvos, where he's helping with Eudaimonia Medical Services team as a volunteer and a project coordinator. Hi, Mohammed.
Hi.
It's a real pleasure to have you here today. If you could possibly give a little introduction to yourself, that would be wonderful.
Thank you. So I'm Mohammed Abdurrahman. I'm working as a volunteer with the Eudaimonia Medical Service, and as Arabic translator and a field coordinator.
And have you been working with I'm not sure I'm saying it right, but Eudaimonia for very long, volunteering with them?
Yes, I'm working with Eudaimonia since they start the organization. Yeah, so
you enjoy it
from day one. Yeah. Yes.
Good.
It's very nice to work with Eudaimonia. Yeah.
Good. Now, can you tell us a little bit about the situation and living conditions for refugees at the moment, for the people who are living within the Lesvos camp?
Yeah, I will give some information and then we talk about the condition there. Yeah, so the new camp in RIC Lesvos, there is 6,000 person living in this camp. But the camp has really emptied out in the past few months. So the people are moving off the island. The biggest challenge in this camp, as has always been difficult, is dealing with the environment and the weather changing.
Yeah.
Right now it's hot weather, and especially inside the tent and the ISO boxes. So we are concerned about that, but other organizations are talking about summarizing. So hopefully there will be some relief from the sun and the hot weather. So the camp is still mostly Afghan. But there are 4 major groups, and about the hygiene is tricky. It's obviously a difficult place to clean. I know there are NGOs providing showers. Are there hygiene promoters who are giving information, but I think the key point is working with the camp's residents to find solution. People are curious how temporary this camp will be and what the new camp will look like. Yeah. So it's really, they live in difficult condition inside this camp, and yeah, about how the majority for the people changing inside, how the food line there, the organization try to manage everything inside with the government, but still it's difficult.
Very much. And when are people mostly still living in the tents that we saw when the camp was first built?
Yes, most of the people living in the tent, and there is a rope hole, big tent, a lot of people inside, and there is ISO box, but they put in the ISO box just the vulnerable cases, the most vulnerable cases in the camp. Yeah.
And do families get a tent per family, or are they sharing?
It depends on about how many person in the family.
Okay.
Yeah. So
each
family
tent
just
holds how many people?
2 family, if it's small families, and if it's big family, just 1. If it's I think it's more than 7 person, they put just 1 family. If it's just like the father and the mother and 1 child, they put 2 families in the tent.
Okay, and what's happened about, you mentioned showers and hygiene, and what's happened about toilet facilities, showers, even being able to wash hands or have access to clean, fresh water?
Yes, they have access for the water, but it's really difficult. The toilets, it's like cabin, and there is no water inside. There is companies, they clean this toilets twice a day, I think. Yeah, but still, it's for 6,000 person. It's difficult, and for the water, it's like there is tank, and there is some point inside the camp you can go there to clean or to get some water. And for to drink water, you take it from the food line with the food.
Okay.
Yeah.
Are people, I remember it used to be 1 litre or 1.5 litre bottles per person a day. Is it still along those lines?
They take, I think, for each person 3 bottles. So it's more than 2 liters for sure.
Okay. Okay, especially in this hot weather, it's needed.
Yeah, they need, yeah, of course, it's needed.
Very much so.
Yeah.
And you mentioned earlier that a lot of people have been moved to the mainland. So obviously when the Moria fire happened, people spoke about 13,000 people, and now the population is down to 6,000. But is it still a mix of families? Are there still lots of children in camp?
Yes.
Or is it, yeah?
There is a lot of children still in the camp, and a lot of families.
Right.
Yeah, from all the nationalities. And yeah, the last few months there are just a few new arrivals, not that much, not like before. Yeah, but still.
Yeah. Okay.
Yeah,
and if we move on from sort of the camp conditions, and if anybody listening does have any questions for Mohammed, please pop them in the chat for him, and I'll make sure that we don't lose them before we've asked your questions. But if we move on to COVID-19, which is actually what we were going to sort of focus on today. Recently, Eudaimonia asked us for a grant because there's a second wave of COVID kind of sweeping over the island and inside the camp. And I know certainly for myself and my family here, we've all now had the vaccine, and most of us have had both vaccines. And so it's easy for us to forget that people are still struggling on the front line of the COVID pandemic. And I wanted to find out about how people are feeling inside the camp, given the length of time this has now gone on for, the fact that people are contained inside the camp and it's quite crowded, it's very hot. How are people feeling about COVID-19 right now?
Yeah, I think here in the camp it's not different than elsewhere in the world. Some people think it's a hoax, and some people are afraid of it. And many have had it. Generally, since the last outbreak, residents seems to be taking the guidance more seriously. But everyone is tired of COVID. Not just here, I think everywhere. The vaccine starts this week, so hopefully it will mean like everywhere else, the restriction can relax a bit. The most important is that people are getting the real information, are not being misinformed or following false information. As a medical and as a refugee, I want to pass for everyone in this camp, good health is the most important thing. I know that with the right information, they will be more accepting for the vaccine and restrictions. People are scared, but also don't seem as scared as I said before, mostly just exhaustion with the restrictions. Masks are mandatory. The social distance is not really possible. It's hard to be told to do something for a year and still not see the results.
Yeah. Have
That's
they been,
why.
have they been, sorry, Mohammed, have they been restricted from leaving the camp?
No, they can leave the camp, but there is rules and like there is numbers for how many person can leave the camp every day. So they can leave and they have access, but because the restrictions and the social distance and these things, yeah, they can like send the 6,000 person outside, and it's
So they
it's
limit the number of people who can leave each day.
yeah, there is limited number. They can leave the camp, yeah, every day.
Do you know what it is? How many?
I really don't have
okay.
exact number. Yeah.
No, that's fine. Just checking. And
Yeah.
you mentioned the vaccine is starting to roll out this week.
Yes, the vaccine start this week, so hopefully the restriction will be more flexible for the people. I don't know. It's so.
Will it be mandatory or is it voluntary to get the vaccine?
Voluntary. So they go and we have a program now. We start a program with the other medical actors. They call it the outreach program. And support from our translator to go inside the camp and with the doctors and under UNCR supervising and inform the people and give them right information about the vaccine and ask them if they want to register themselves to take the vaccine. And yeah, and we have already people get the vaccine in the last 3-4 days. Yeah.
Good. And do you have a feel for whether people believe in the vaccine, or if do you think that there'll be most people will take the vaccine?
Do you have we still have difficulty to convince the people about this. That's why we this program run now in the camp to convince the people and say it's very important for you to take the vaccine and to change this restrictions and the limited movement. So after the vaccine, if everyone in the camp or most of the people accept this, that will change a lot for the condition and for their life there in general, because now with this condition it's very difficult to live with the COVID rules,
Yeah. No, so the program that you're working on with Eudaimonia is that you're translating a lot of the information into the languages relevant within the camp and providing information to people so that they're better, I think, so they have a clearer idea of what's going on around them so that they can make their own decisions and feel trust as well towards the process that's happening. So it's really, really critical program.
Yes, this program is very important to give the right information, and when it's coming from our translator, the effects is different because we are a refugee. That translator who volunteering with Eudaimonia or refugees, so the people, I think the effect on people is different. Yeah. And now the numbers who register themselves to get the vaccine is different than when they start in the beginning. So every day we get more people who want to register themselves.
Yeah. No, well done for the work that you're doing and for taking care of people this way. It's wonderful. What measures have been taken? Like we've talked about the vaccine and the isolation areas and the hygiene in the camp, but is there anything else that's being done either by the government and the authorities or by NGOs and medical practitioners to help with the COVID situation?
Yes, of course. Every in the clinic we work, when the patient come, not just ask about the sickness, we ask about if they have any information about the COVID, and we give information. We explain to the patient about the virus in general and about the rules and why the people put these rules, and so in the clinic, we help to give the right information for the people and why they have to wear the mask, why they have to keep distance, why they have to use the sanitizer. And now after they start the program for the vaccine, they start give information for the patients who come to the clinic about the vaccine and why you should taking the vaccine, and give them all the information and answer for all the questions the patient have it. And we do a test for the people, the rep test, who's visiting the clinic, mostly volunteering, or if anyone have any symptoms, we send them directly to EOD, the public health organization, and they doing the test. And like if anyone tested positive, they take them to the isolation area, and if it's negative, they send them back to the clinic to see the doctor and give them the right medication.
Okay, great. And the isolation area, did you just want to touch on sort of what happens at the isolation area?
So if anyone tests positive, they send them directly to the isolation area. They supposed to be in the isolation area for 14 days. And they provide them with food, water, everything they need. There is inside the isolation area tents, and it's closed area, and but there is doctors checking the people every day in different time, and they can talk with the people and check with them if they need anything. And I don't have a lot of information about inside the isolation area, but the people can visit their families if they inside. And per time there is 8 person, and they put just the positive cases inside.
Okay, together. Thank you for that. Just sort of one last question from me, which I haven't actually prepared you for in advance, but have there been any deaths in the Lesvos camp from COVID?
I don't think. I don't have any information about this now, but I didn't hear about any case.
Okay.
No.
I mean, that's quite miraculous in itself.
Yeah.
So a good thing, a positive thing. Do you have anything? We don't have any questions from anybody watching. If you are watching and you'd like to ask Mohammed a question, we will be wrapping up in the next few minutes, so please pop it into the comments. Do you have anything else that you'd like to add or send any messages to anybody, Mohammed?
I really don't have any message just to the people they don't want to get the vaccine to get the vaccine, because it's good to protect yourself and the others around you, and to change the condition we live in it now, the restrictions and a lot of limited movement. So I think now the people have to really take it seriously and go for this. And I want to talk about our organization in general. So Eudaimonia is an organization giving medical service. First mandate to provide medical interpretation with a team of 35 translators. Eudaimonia provides translation at the clinic, at the camp in Lesvos, and we have team in the clinic and at the general hospital in Mytilene, and in the small clinic in the city. The team also supports other NGOs with off-site interpretation for social support, lawyers, or psychological appointments. Eudaimonia has a program of complex cases, making sure the asylum seekers can get access to exams they need, such as MRIs and ultrasounds. after doctor referrals, the NGO books appointments and pays for them, inform the patient, and drive the patient, and bring them the results after this. And Eudaimonia also provides supports for other medical actors in emergency situation. Eudaimonia provide the post-vaccination gets to the island hotspots. Sorry, Lesvos. Yeah, Lesvos, Chios, Kos, sorry, Leros, and Samos. And we are involved in a COVID vaccination registration outreach program in the camp with all the medical actors under the supervision of UNHCR.
Fantastic. It's such an amazing service, and I feel so proud of you for doing it, and for all of the 35 interpreters that are taking part in Eudaimonia and the service that you're delivering. You're doing a truly amazing job. Well done.
Thank you.
I'm really proud. It's amazing.
There is a question,
sorry.
I think. Sorry.
Yes, Flip has just popped in with a question. So she's asking, have any refugees been taken to hospital with COVID, or have people's health all been managed internally within the camp?
Yes, there is people going to the hospital with COVID if it's needed. Yeah, and if it's severe cases, they go to the hospital, and the hospital take care of them. Sorry.
Yeah. Just, and I guess that leads on to kind of an added question, which is about the ability of the hospital in Lesvos to deal with COVID for the Greek people and the local population, as well as the camp. Is there anything that you'd like to add about the hospital itself and the capacity there?
They still managing getting all the cases we sent from the camp, and I think all the cases we send it, they get in good care there in the hospital, and yeah, that's why I didn't. Yeah.
I think everywhere around the world there's been this issue with ventilators and medical staff being over capacity, and just the stress and the strain of PPE and everything.
Yes, exactly.
So it's understanding how Mytilene Hospital is coping with that. Yeah. Well, thank you very much indeed, Mohammed, for speaking to us today. It's been a real pleasure. You can relax now. And I hope that we chat again, but that it stays positive. And well done for everything that you're doing, and best of luck with the vaccination rollout. We're all supportive and hoping that it goes really well.
Thank you so much.
Thanks very much, Mohammed. Thanks.
Thank you.